Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. And as I always promise, the second half of every single Wednesday show, we have Singing River Health Talk. And as I teased at the beginning of the show, today we're going to be visiting with Dr. Philip Myers. He's an orthopedic surgeon, has a lot of trauma experience. He's a hand surgeon. He kind of does it all. And if you go back and look at what he specializes in, what you see is the growing role that technology is playing, which is a common thread through just about every conversation that I'm having with physicians at Singing River Health System. So without any further ado, let me welcome my new friend, because we share a love for the outdoors, as we were chatting before the show started, Dr. Philip Myers, orthopedic surgeon. How you doing, Dr. Myers?
Thank you so much for inviting me on the show.
It's really good to see you. Listen, it was interesting to read about you. You do it all from an orthopedic surgery point of view, with a special emphasis on trauma and hand surgery. Let's take a step back for a bit. We were just chatting before the show started about Heidelberg University, which is just north, I think you said, of Columbus, Ohio. You grew up in Texas. Did you always know you wanted to be a doctor?
Not at all. I was actually going to be doing media. So my major in college was actually television broadcasting. And at some point between my sophomore and junior year of college, I kind of had a moment in my life where I said, how can I best benefit my community, the people around me, with the skill set that I have? And so I kind of made a complete and total 180 from the kind of arts community in television, and did a 180 back into kind of the science and technologies portion of education, and then pursued medicine from there. So it was a complete and total 180. But I tell you what, I'm very grateful for the opportunity that I had to kind of learn that communication, that broadcasting, that art of interacting with other people over the course of my training, because that has helped me immeasurably as a physician and as a surgeon, because a large part of what I do is communicating, and I feel that oftentimes is the most important part of what I do.
Yeah, you can tell that you're a great communicator. And it's interesting. I went to paramedic school at the University of Alabama in Birmingham and was in pre-med. And my goal was to become an emergency room physician. And I did a complete 180 and went to media. So, it's interesting, the parallels in our work. But, it's amazing. When I was studying Singing River Orthopedics, the fact that this division of Singing River Health System has over 900 surgeries annually. This is a busy team that does a lot of specialization, isn't it?
Yes, sir. And what I'll tell you is a lot of people don't believe me, because those numbers seem outrageous, right? What I would tell you is the majority of our team spends more time talking people out of surgery than we spend convincing people that they need it. Because one of the things that was very important to me as we started this service line for Singing River was we want to make sure that surgery is an absolute last option. I love surgery. The reason why God put me on this earth was to do orthopedic surgery. However, myself and our team, we do not want to be doing surgery that doesn't need to be done. So when we see patients and we approach our patients from a continuum of care standpoint, what we always want to do is we want to try to do the easiest, most simple, least invasive, conservative treatments first. And if we find that all of those conservative treatment pathways do not achieve the result that we want, then we consider surgery. So what I would tell you is about every 3 patients out of 100 that our team sees will eventually get surgery, but it's a very small percentage. So to put things in perspective, we might be doing 900 surgeries a year, but that gives you an understanding of how many patients we're seeing every year that generates those surgeries, if that makes sense.
I think it's a great thing to say. I mean, I can remember there was a point. This is like I had when my daughter, who's over 30 now, was just a baby. I leaned over in the back of the car to pick her up, and as a result of that, learned that I have an L5-S1 deformity, and every doctor that I saw wanted to do surgery. And a friend of mine who was a doctor said, well, if you want surgery, go see a surgeon. But I would recommend you not do surgery and just rehabilitate. And all these years later, I've tracked over 2,000 miles of running. I've worked out with weights for 45 years. I'm as healthy a guy my age as you're ever going to find. But it's just an example of sometimes you don't need it. And I think it's quite a statement about your work that you would focus on that in the conversation, because I think there are a lot of surgeons that if you go to them, they're going to probably do surgery. And I love the fact that you're committed to giving people the best outcomes. Sometimes that doesn't involve surgery, does it?
You're absolutely right. Most often that doesn't involve surgery. And I think that's one of the things that really uniquely separates us as the Singing River orthopedic team from maybe some other people, is that we truly don't want to do surgery unless we have to. Because I try to put myself in the patient's shoes every time. And it's like, well, would I need surgery for this? Probably not. Well, then I shouldn't be recommending surgery. Um, so the vast majority of what we do is conservative orthopedic musculoskeletal medicine, by an overwhelming percentage as compared to actual surgeries.
So your specialty is very trauma based, and you think about the hand surgery specialization, which is always much needed in a place like coastal Mississippi, where there's a lot of manufacturing facilities, advanced manufacturing that still involve people having to get in there and do really critical work, and some really bad things can happen. So it's clear that your specialty, the trauma side of hands, the surgical side of hands, is something that I'm sure they're glad to get you on the team for that reason. But it's true. I mean, we need great hand surgeons in coastal Mississippi, don't we?
Absolutely. I think that, obviously, kind of, we have a very large blue collar manufacturing, manual labor force and population down here on the Gulf Coast. And certainly your hands are at risk with a lot of that machining, a lot of that labor. And a lot of those complex hand injuries tend to find our team. And we always tell people, look, we're going to try to make your hand as good as we can make it. And as we were talking about before the segment, from an expectation standpoint, we really try to give people expectations up front on what some reasonable goals are, because some of these injuries can be pretty catastrophic. So when we address that, as soon as we meet and see these patients and evaluate these patients, we really try to give them a look, this is where we expect you to be. And I tell patients, if you do better than this, I'm fine. I'm wrong all the time. Ask my wife. She'll tell you I'm wrong all the time. But if we can get you to here, these are where some reasonable expectations are. And if you exceed those expectations, wonderful.
Yeah. Yeah. But it's amazing, man, what you guys are doing. Thinking about robotic assisted hip surgery and the other kind of advanced technologies that you're using. I've say it every week, but I think it's important to note that one of the most profound reasons that Singing River Health System is able to attract doctors like you is that they are continually investing in the tens of millions of dollars that's required to stay on that cutting edge. And you understand that very clearly, don't you?
Yeah, I think the technology within medicine is expanding exponentially. It's awesome. Um, and Singing River, the administration, the entire leadership team has been immeasurably supportive of adapting those technologies, with the understanding that I also have to use some common sense, and all of us as physicians have to use some common sense that tells us when this technology will actually generate a better outcome versus just the same outcome, and we're just by chance using some technology to achieve the same outcome. So there is a lot of discretion that we have to use as physicians, because not all new technology and new products are better. We just have to make sure that when we adopt those, they have been vetted, by methodical research papers, to make sure that that is actually going to generate a better patient outcome for our Mississippi population down here.
Hey, listen, both of my sons played soccer. Both of them tore their ACLs, and they had, they both dislocated their patellas and have had issues related to that as they've gone older. But I see for ACL repairs, there's this bare implant that's being talked about a lot. What is that?
So the Bayer implant is a bovine-derived collagen graft that essentially comes from a cow. But the idea is, and a very smart gal out of Harvard kind of developed this and has kind of undergone multiple research studies over the past 15, 20 years. But ultimately, what it is it allows people to regrow their ACLs. So the idea is that this forms a bridge, a healing bridge of scaffolding that allows your body to use its own healing cells to travel that bridge for that ACL to reattach where it's supposed to go. And the idea is that when we do ACL reconstruction, I can't put your ACL where the good Lord put it. That's impossible. We try to get it as close as humanly possible, but we can never get that perfect. The benefit of this Bayer implant or regrowing your own ACL is that it's going to attach where it's supposed to attach, where it is supposed to be, not where I think it's supposed to be. So the idea is that the benefits would include better mechanics after surgery, meaning your ACL is actually where it's supposed to be, so it can function the way that it's supposed to be. Number two is that there's a large portion of this that also says that this will spare some of the cartilage as these ACL patients grow, mature, and live later
Hey,
in life.
let's do this, Dr. Myers, orthopedic surgeon, Singing River Health System. When we come back on the other side, we'll pick it up right there. We'll see you after this break. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. I say it every week, but this opportunity to get to know these professionals at Singing River Health System has been terrific for me because I enjoy getting to know smart people and people who enjoy getting to know. The other thing is that they're all good people. They all care about their patients and they have this ability to communicate. I came from a long history as a communication guy. Been part of Pulitzer Prize winning teams, and I haven't met one of these yet from the team that's joined me here on this show that's not a tremendously good communicator. And Dr. Philip Myers is literally no exception to that. Hey, I don't want to short shrift the conversation we were having about the Bayer implant, and you were mentioning something about the to minimize future cartilage issues related to the ACL tear. Why don't you pick it up from there? Because I want to make sure we tell the complete story related to that.
Sure. Well, when we traditionally reconstructed the ACL, we changed the mechanics of the knee subtly because the ACL wasn't in the exact spot where it was before. So with the ACL being able to regrow, the theory is that will help the normal mechanics of the knee that were there before you tore your ACL so that there is less post-traumatic damage to that cartilage. Because it's just like the alignment on your car, right? If you're constantly veering to one side, you're going to have abnormal tread wear. You're going to have abnormal wear on your ball joints, your control arms, your struts, your shocks, all those things. So the idea is if that ACL grows where it's supposed to grow, that will minimize those post-traumatic abnormal mechanics of your knee to allow your cartilage to be as normal as possible for as long as possible.
Well, that was the point that you were making. Both of my sons, after the ACL tear, have had, as they've gotten older in their lives, both of them have had issues with cartilage. And that's because the point that you were making, when you have to put a new ACL in, you can't put it exactly where it was before. And that changes the mechanics of the knee and creates wear and tear that otherwise would not have been there. So that's a cool, very cool thing. Hey, in the short time we have left, there's two other things I want to make sure we talk about. But the Lapiplasty 3D bunion correction, bunions, people don't like to have to worry about it, but man, there are a lot of people who have bunions, and this is a real possibility for a correction for them.
Yeah, it's been a great procedure. We adapted it about 3 years ago, and I stayed out of the bunion game for a long time because we didn't have a great solution to bunions. There's about 50 ways to do them, and whenever there's 50 ways to do something, each individual way is independently not all that great. But when this technology came out about 3 years ago, we adapted it immediately, and I have been so grateful for that technology because I never thought I'd be doing all these bunions. But people's deformities are getting corrected. Their healing times are exponentially faster than they used to be. And most importantly, their foot is mechanically more normal. And in orthopedics, there's not many surgeries that I do where somebody's body looks different, right? If I operate on your shoulder, still looks like a shoulder. I operate on your knee, it still looks like a knee. But these bunions also have a cosmetic component to them. So people have been immeasurably satisfied with not only the function of their foot, the reduction in pain, the healing time, but also the cosmetic appearance of their foot.
Well, look, listen, you and I talked about spending time on a boat, but this Active Armor 3D printed cast, I mean, you had to know with 3D technology emerging the way it was that the applications to orthopedics would be there. But the only provider on the Gulf Coast providing this waterproof, breathable, it's amazing what 3D technology has done, isn't it?
It's outstanding. It's a very durable, waterproof material that if you break a bone and it's one that you need a cast for, we'll call it the Horn Island Special, because once you get it on there, you can go do whatever you want to out at Horn Island, go swimming, get it wet, and it makes everybody's life easier, especially parents with kids. Like it's in the summertime, kids want to be in the water in the summertime. So these 3D casts can do a great job at letting kids kind of maintain, kids and parents maintain their sanity throughout the healing process of a broken bone without having to have that methodical and annoying maintenance of keeping a cast clean and dry.
I remember, man, I fell out of a tree when I was like 10 and I broke my arm and I had to wear a cast for a long time. And I never will forget how much it itched. That's what I remember the most, how much it itched. And I was a typical kid, man. I got it wet when I wasn't supposed to. And that created a whole nother set of problems and had to have it, switched out a couple of times. But, I think, it's interesting talking to you. We got less than a minute left, but, the opportunity that your orthopedics group, you're just an extension of that, but the very specific care, the human side that you guys bring to the table is so notable in this conversation.
Well, yeah, we always try to keep it at the forefront of our minds that we might be seeing you for a shoulder or a knee, but that shoulder and knee is connected to a human being. So one thing that I will say, and I impress upon the medical students that I teach too, is that we have to get to know our patients to make good healthcare decisions with them, because we're a team. The patient and our providers, we're a team. And so when we have that relationship established, it really helps us to make the best decision based on what we know of the human being that body part is connected to. And that's really, I think, where the art of what we do comes in, because I think when we know people, we're helping them make great decisions for themselves and their futures.
Well, that's evident. And by the way, your communications training did you really well. What a great skill set to have when you're also a doctor. This has been Singer River Health Talk, and this has been a wonderful visit, like all of them each week, with Dr. Philip Myers, orthopedic surgeon. And it's been a pleasure to meet you, my friend.
Thank you all so much for taking the big with me today.
It's been terrific. Listen, have a great day, and we'll see you tomorrow.
Take care.